So my name is Dr. Kris Urbaniak, and I'm obstetrician gynecologist, and I practice here at the Adventist hospital. Just would like to say a few words about antenatal ultrasound scans. This is area of obstetric medicine that I have a special experience and degree in. Look, ultrasound, you can hardly imagine provision of modern obstetric care without ultrasound scans, which should be also performed on a high-end machine to provide the best information for the patient and best information to decision making. It is used in early pregnancy to confirm dates, to confirm the number of babies and how they develop. It is used from the early pregnancy to confirm how many babies, how far in the pregnancy the patient is. Sometimes location of that pregnancy, and then how the baby develops. We're scanning to check particularly the baby's appearance at about 10 to 11, 12 weeks. Make sure that all the early morphology is normal, that there is no suspicion of any abnormality there. That is again repeated at 18 to 20 weeks. There are big protocols how to do it, to look at all the organs and make sure that everything looks fine. If there is any abnormality found, then that requires sometimes further testing and with enough time. There may be enough information for patients to choose best course of action and prepare for some intervention later. Those are, however, minor percentages. Most pregnancies develop just fine. One of the advances in the obstetric ultrasound is now the checking risk of pre-eclampsia on the basis of some markers on ultrasound scan, together with blood tests. Obviously, the Down syndrome, that's been long established. We're looking now for monitoring cervical length, and so calculating risk of early and preterm labor. Obviously, placental location and diagnosis of any antenatal bleeding, which sometimes is very distressing and requires action. But again, most of the time, it's all that's necessary is just some ultrasound scanning and reassurance. Monitoring of the baby's growth is important. As I mentioned, in the current society that sometimes has multiple medical problems, so it's important to check how the baby is developing in certain conditions. We do have now more and more sophisticated ways of imaging the 3D and 4D real-time baby's face reconstruction. In my experience, ultrasound scanning in pregnancy, whether that's just 2D or 3D or 4D, it helps parents connect with the baby. They want to know how the baby looks. They really appreciate having some photographs. And then they compare how the baby looks after birth. Ultrasound is also used in labor. It is a very good, especially in multiple pregnancy, but also in a singleton pregnancy. It's useful to monitor progress sometimes, position of the baby, and completeness of expulsion of the placenta. So it's just a small area of obstetric medicine that is very important these days, and difficult to do without.